If you've been told you need knee surgery, whether it's a replacement, a clean out, or just another injection, you're probably feeling a little overwhelmed. And that's understandable. Surgery's a big step. It's emotional, and in most cases, it's permanent. What I want to do in this video is help slow things down, not to scare you away from surgery. There are times when it's absolutely appropriate, but far too often I see people push toward it without knowing the full picture. Let's talk about what the research says. Let's talk about what you should know before committing, and let's talk about the other path, the one that's helping many people avoid surgery altogether. First, let's talk about arthroscopic knee surgery. What people often do or call a clean out. This is one of the most common procedures offered to people with osteoarthritis or chronic knee pain. But here's the surprising part of it. It doesn't hold up well in research. One of the most well-known studies published in the New England Journal of Medicine looked at people with knee osteoarthritis who had arthroscopic surgery and compared them to people who had a fake or sham surgery. The result? There was no difference in pain or function between the two groups. In other words, the clean out didn't perform any better than the placebo. Since then, multiple studies and systemic reviews have confirmed it. Arthroscopy for knee arthritis doesn't offer meaningful long-term relief, and yet it's still commonly performed. Not because it's backed by strong evidence, but often because it's familiar, fast, and reimbursable. Next, let's talk about knee replacements. For some people, a knee replacement can be life-changing, but for others, it leads to more frustration, more pain, and more procedures. Here's what the data tells us. 1 in 5 patients report they are not satisfied after surgery. About 10% of replacements will need to be redone within 10 years. Sooner if you're under 60. Recovery is long. Risks include blood clots, infections, scar tissue, and persistent stiffness. And most importantly, once you replace the joint, there's no going back. So if someone tells you, you just need surgery, it's okay to ask, is this really the best first step? Or is it just the next most common step? Then there are injections, cortisone, hyaluronic acid, and even PRP. Cortisone can offer short-term relief, but used too often, it can actually damage cartilage and speed up degeneration. Hyaluronic acid or gel injections are hit and miss. Some people feel a bit of relief, others feel no difference. And large reviews show the average effect is about the same as placebo. Even PRP, which is more natural and promising in some studies, still varies widely depending on how it's prepared and administered. In short, none of these options are guaranteed and none of them fix the root issue. So what do we do instead? This is where the WalkStrong Framework comes in. I created this system after years of watching patients go from one stopgap solution to the next, never really getting better. WalkStrong is a step-by-step, non-surgical approach that works with your body to heal and rebuild your knees before surgery is ever on the table. We use therapies that are backed by research, including laser therapy, which helps reduce inflammation, stimulate tissue healing, knee decompression, which gently relieves pressure in the joint and improves circulation, shockwave therapy, which breaks up scar tissue and promotes regeneration, neuromuscular re-education to retrain the muscles and stabilize movement patterns. These aren't fringe treatments. There's solid science behind them. And when combined in the right sequence, they help create an environment where the knee can heal itself. I've seen this firsthand with so many patients. One of them was Mike. He came into us and was told he needed to have a knee replacement. He was in his early 60s, still active, but his knee pains made walking the dog a daily struggle. He was on a surgery waitlist when he came in. We walked him through the WalkStrong Framework and started care. 3 months later, he was walking 30 minutes a day, off the waitlist and pain-free. He told me, I just didn't know this was even an option. And that's what drives me. Not just helping people feel better, but giving them back options they didn't think they had. Now I want to be clear. I'm not anti-surgery. There are cases where it's absolutely the right choice, but it shouldn't be the first choice for most people. But it shouldn't be the first choice for most people with chronic, non-traumatic knee pain, especially when conservative, evidence-based care hasn't even been explored yet. You deserve to know all your options. You deserve to know that you're not broken, that there's a process to rebuild, a path to healing. So if you've been told you need surgery, slow down, ask more questions, get a second opinion. from someone who looks beyond just the joint and sees the whole system. You may not need a scalpel, you may just need a better plan, and we'd be happy to show you what that can look like.